Dr. Weiss is on the line. Dr. Weiss works with me, and she is one of the most amazing physicians I've ever met. She's an internist, and she's actually dedicated really to women's health. Thank you for coming on board, Dr. Weiss. Let's talk for a few minutes.
Oh, well, I'm so happy to be here, and I'm so happy that you're trying to explain to people what this very scary article was all about. It was very disturbing to read this, and I have been speaking to patients all morning, and many of them are so nervous now about taking hormones again because they don't clarify, they don't make distinctions, and we're left with this category of hormone replacement where it is not recognized that there's a difference between bioidenticals and synthetic hormones, just like you're explaining.
Yeah, and I think the biggest problem is that the Women's Health Initiative and the societies who really, by the societies, I mean the North American Menopause Society and the American College of Obstetrics and Gynecology, do not represent the interests of the constituency, the physicians that make them up, or the interest of the patients. They represent the industry's interest, and they actually stand to gain, and I don't understand how they stand to gain, by muddying the waters and making all, indicting all hormones, saying all hormones are bad, when in fact we know unequivocally since 2002 and maybe even before. I mean, you and I know, any physician who read literature, medical literature in the 1980s and 90s, knew even 10 years before the Women's Health Initiative that Premarin was a dangerous drug, that Provera was a dangerous drug. And what I find really appalling is the fact that all drugs are now created equal. The patients, women are scared, and they don't know the difference between synthetics and bioidenticals, or naturals, as we call them. And they will go off hormones again because they're scared. And without hormones, they'll wind up with antidepressants. They'll wind up sick and old and not contributors to society.
Well, I remember when the Women's Health Initiative when they first published the studies that showed how harmful the drug was. And at the time, I was in my internal medicine practice. And I then remember how they came down with guidelines, and they weren't to stop using the drug and take the drug off the market and switch to bioidentical FDA-approved drugs. The recommendations were to give the same drug at a lower dose. And not only did women suffer from this because they actually needed more hormone, but clearly we were doing them harm.
Exactly. And I think that as a physician who actually became a physician because I want to help people, and you're in the same position as I am, it is actually counter totally to our philosophy and what we're there for. We want to help women, and we're encountering this brick wall, which is all about profit, and it's about hurting women. And all these women who don't take hormones or take synthetic hormones, as in Premarin and Provera, are actually harmed by this horrendous industry that is created to make money off of our suffering, out of women's suffering. And I find that unbelievable. This is 2011 almost. And I'm wondering if this had been something, a drug that was for men, something that helped men. I'm just, and it's not against men, obviously, because we all love men. But if it was about men, I mean, you know what? The medical establishment, although today they're half of the women going to medical of the people going to medical school are women, it's still run by the men. The establishment is run by the men. I mean, the people that I deal with when I give a lecture at Harvard, the head of OBGYN there is a man in his 60s. When I go and give a talk and there is a academic physician standing next to me, it's a man in his 50s or 60s. Men, and the most appalling thing, and I have to, and you were there, is I gave a talk at the 92nd Street Y last December. And Dr. Stephen Goldstein, who is the incoming medical director of the North American Menopause Society, was on the same panel with me. It was the two of us. And he said something that blew my mind. And I don't know if you remember it, but it blew my mind. He said to me, And he didn't say it to me. He said it to the audience, which was like 200 people there. And he said, as a male, I understand better than anybody else how to treat women because since I don't feel hot flashes, night sweats, insomnia, any kind of symptoms, I am more objective. Yeah. And I find that repulsive. How can anyone, it's like me talking about somebody's testicles, that I understand how it feels to have a pain in the testicle. I mean, I will never be that ostentatious or audacious or unbelievable. And, you know, I cannot believe these are the people who conducted the Women's Health Initiative. These are the people who are telling us to continue giving patients Premarin low dose for shorter periods of times. These people are not taking the Premarin. I was taking it. I don't know if you were taking it. I just made sure that Wendy never took it because she went on bioidentical hormones because I figured it out early on. I mean, I don't know. Did you ever take it, Dr. Weiss?
Nope, I never took the Premarin, but I did early on prescribe it. Because that was what was recommended, and even though there were reports, I think everything is shaded for its best light, and so the reports that did come out that had any advantage whatsoever were really advantages of possible estrogen, not particularly Premarin, but those were things that were emphasized as giving hormones to women.
Exactly, and the thing is, nobody wanted to make the distinction because when Premarin came to the market in the late 60s, it was on the heels of bioidentical hormones, estradiol, having been on the market since the 30s and doing very well for women. And it was a very smooth, under-the-table transition that women and doctors never knew there was a transition made because nobody knew that Premarin stood for pregnant horse's urine.
Right. And, some of my disappointment at this time is not only, the industry promotes itself, and it's clearly a financial benefit for them, but I have a lot of difficulty with colleagues of mine. I don't understand why colleagues can't look at a chemical formula and distinguish between a drug like Premarin and a bioidentical hormone and not know that one would be better for women than the other.
And they could never act the same because they don't look the same. Bioidenticals look exactly like what our body makes,